Good day, everyone, and thank you for taking the time to join us today. We are excited to share with you how our team can directly support HR leaders like you in driving organizational success. Is the slide familiar to you? Is your HR team feeling as stressed as she is? May I ask what challenges you currently face when it comes to managing your HMO? Are you spending a lot of time monitoring member additions and deletions? Are you also the one tracking card releases and billing? Do employees approach you directly whenever they have questions about their HMO benefits? Do you still receive messages or calls from them even after office hours, on holidays, or during weekends? If so, we can support you. Stop managing paperwork and start focusing on managing talent. Let us handle the administrative work for you. Who is LaMarchelle? Think of us not just as a broker, but as your extended benefits department. We handle the heavy lifting, from the initial negotiations to the daily grind of claims processing. Our goal is to free you up so you can focus on growing your business. Our promise: we act as your strategic defense against rising healthcare costs. We know there are usually two mindsets in the room. To the HR leaders, our promise is zero headaches. We take the claims off your desk. To the finance leaders, our promise is sustainability. We use data to prevent shock increases in your premiums. So why partner with us? We deliver value across two main areas of your business. For HR and operations, we promise implementation and expertise. We differ in how we deliver these benefits. First, our implementation is personalized. We take the time to understand your specific company culture. We don't do generic packages. We provide tailored advice and ensure benefits are cascaded or explained clearly to your staff. Second, we offer deep expertise. Insurance policies are confusing. We decode these complex policies for you, guiding your team so you are never left guessing about compliance or coverage details. Zero headache claims management. We take over the filing and tracking of claims completely. We ensure your employees get the best possible outcome without that hassle landing on your desk. For finance and strategy, we focus on sustainable cost savings. We don't just accept the first price. We negotiate better rates and discounts to transform your health plan into a sustainable investment rather than a sunk cost. Next, you benefit from our wide provider network. Because of our strong partnerships with top-tier HMOs, we are able to effectively benchmark terms across the industry. This ensures you are always getting the most competitive market price available, rather than settling for a standard rate. Finally, we provide data-driven control. We don't just look at the numbers at the end of the year. We actively analyze utilization trends and your medical loss ratio, MLR, to spot cost drivers early. This helps you prevent unexpected premium hikes at renewal and keeps your forecasting accurate. How do we actually deliver on these promises? We follow a 5-step cycle designed to keep you in control. 1. Consultation, the deep dive audit. We don't start by selling, we start by auditing. Instead of just asking for a copy of your contract, we conduct a utilization study to find leverage points. We look for enhancements we can include without adding cost, and we identify exactly where your current provider might be under-delivering. 2. Remarket, creating competition. Next, we go to the market. We don't just accept the first renewal offer. We take your specific terms of reference and farm them out to our network of providers. We make the top HMOs compete for your business, presenting you with a clear comparative study so you can make a data-backed decision, one you can confidently present to your top management. 3. Implementation, the employee experience. Once the ink is dry, we handle the heavy lifting. We don't just hand over a policy, we focus on cascading. We explain the benefits clearly to your employees so they actually understand what they have. From validating the contract to ensuring ID cards are issued on time, we ensure the program launch is seamless. 4. Reporting, proactive insights. This is key. You will never have to chase us for a report. We schedule utilization reviews quarterly by default. We analyze the data continuously so we can spot trends, like a spike in specific illnesses, before they become budget problems. 5. Renewal strategy, not panic. Finally, we treat renewal as a strategy, not a deadline. We start the process 4 months early. By the time your renewal date arrives, we've already analyzed the market and secured the best possible terms, ensuring you never have to make a panic decision at the last minute. I want to spend a moment here because this is your strategic defense against rising costs. Most brokers just forward you raw Excel files at the end of the year. We provide actionable insights while there is still time to act. Take a look at this real-world example from ABC Company. 1. The insight, visualizing the risk. If you look at the chart on the bottom right of the summary, distribution by availment type, focus on the distinction between the green line, number of cases, and the blue bar, benefit paid. You'll see that outpatient has a high spike in cases, almost 9,000, lots of people going to the doctor. But the blue cost bar, while significant, is the sum of many small interactions. Now look at inpatient in the middle. The number of cases is very low, only 832, but that blue bar towering over 13 million. This tells us immediately, the company isn't suffering from frequent minor illnesses. They are getting hit by a few catastrophic high-cost confinements. 2. The consequence, the MLR. Now look at the far right of the top-level tiles, a 108% medical loss ratio. This is an even worse scenario than a high 90s number. In simple terms, for every peso this client paid in premiums, the HMO spent 1.08 pesos on claims. The HMO is losing money on this account. As the call-out on this slide points out, high MLR triggers premium hikes. This client is in the extreme red zone, and without intervention, their renewal increase will be massive. 3. The intervention, our value. Because we spot these drivers and the catastrophic claims in inpatient early, we don't just watch it happen. For this client, we immediately analyze the reasons for those high-cost hospitalizations and targeted preventative wellness campaigns at those underlying conditions, like preventing chronic conditions from becoming acute emergencies. 4. The result, we are able to get in front of the crisis. We can't change the past year's 108%, but by showing the HMO that we have identified the root causes and are actively managing them down now, we can negotiate far better renewal terms than if they just see the raw loss. That is the difference between getting an Excel file too late and having strategic control. Instead of being blindsided, you are managing your budget and your people's health actively. Finally, our independence is your advantage. We maintain a wide partner ecosystem with top-tier HMOs and insurers like IntelliCare, MaxiCare, PhilCare, and Etica, among others. Because we work with the industry's best, we can benchmark terms and ensure you are getting the most competitive market price. We find the perfect fit for you. But here is how we differ. We grade them. We have a scorecard for the vendors based on their operational performance, like how fast a letter of authorization is issued for a consultation or procedure. Number of accredited hospitals, clinics, and doctors are your top providers among their accredited facilities. All right, moving on to the next steps. To proceed, we'll need a few key documents from your team. First, we'll ask for your appointment letter. This formally authorizes us to solicit proposals on your behalf. Second, we'll need your schedule of benefits, including the employee category, room and board category, and MBL, or, alternatively, a copy of your existing contract. Third, please provide your utilization report so we can assess your current usage patterns and identify opportunities for improvement. And finally, we'll need your master list of employees and dependents. This should include the employee category, date of birth, gender, and relationship to the principal member. Please note that names should be omitted for data privacy. Once we have these documents, we can move forward with. To wrap up, we handle the headaches of HR operations and we secure the financial sustainability your strategy team demands. The next step is simple. We invite you to a discovery session where we can look at your current utilization data and show you exactly where Le Merchel can improve your coverage and reduce your costs. You can reach us directly at the number listed here or via email. Let's turn your healthcare plan into a strategic advantage. Thank you.